Yeah, you can't miss that. Thank you, James. Well, starting on Thursday, everyone 50 years and older will be eligible to get the coronavirus vaccine statewide. Vaccinations are accelerating and hospitalizations are dropping, though public health leaders have expressed some concern about an uptick in new infections in other parts of the country. For more insight, we want to bring in now Dr. Monica Gandhi. She's a specialist of infectious disease and a professor at UCSF School of Medicine. Dr. Gandhi, thanks for your time this morning.
Thank you.
I want to get to vaccinations, but first let's look at kind of the latest numbers because it's been we're at an interesting point of the pandemic as a lot of the Bay Area is moving into less restrictive tiers. How are you reading the latest numbers?
Every state is actually behaving somewhat differently. So California is doing great, as are 25 other states. And then there are some states where the numbers aren't going down as well. And there are some states that they're actually increasing. Um, this is not unexpected, to be fair. The hospitalizations per case are coming down extremely nicely. What does that mean? It means that people who are actually vaccinated are not the ones going into the hospital. They are the ones who have been spared and do not have severe disease. So older people, the hospitalization rates among older people are plummeting. And this exact same thing happened in Israel right at the beginning of their vaccination campaigns. There was a stubborn sort of at times increase in cases or more cases as people were getting excited that they got their vaccinations, and then it just fell. And that's going to happen in this country.
We were just putting up a graphic where you can see the latest hospitalizations positivity rate, and you see that huge spike that we had over winter. And as it's come down, as you see it there, there's been a lot of talk of is it stalling? Could there be a fourth wave? What point are we at now as it's dropping? And what should we look for? And when we know kind of when we're out of the woods or if we could be going into a fourth wave?
I think in this state, we're doing really well, as you've illustrating here. And we also have maintained our restrictions along with our increasing vaccination rates, like you just said, Thursday for people over 50 and April 15th for everyone. So those increasing vaccination rates and keeping on there's still masks in California. There's still 20% to 25% capacity. All of that is, I think, working in our favor. I think all of those restrictions can go away later, but this kind of combination of not letting everyone completely be wide open and putting vaccinations out this fast, I don't think we're going to see a fourth surge in our state.
I'm glad you brought up vaccinations because let's get to that. I also think we're at this middle place, right? Where some people have had it or started to get the vaccines. Some people have been fully vaccinated. I believe it's about 29% have received a dose, about 16 million doses administered, but then there's others who haven't. So I'm curious, first off, what do you think of the supply? Because while things have changed and now more people are eligible to get it, and those more are going to be coming up in the next few weeks. I'm curious if you think the supply is going to be able to keep up with the demand, at least in these next few weeks.
I think the supply is going to keep up with the demand because they wouldn't have said it if they didn't have it. And the reason I think that is there was this like very specific problem with the mRNA vaccines that they needed to make this lipid layer around it, and they fixed that supply problem in February. So this was expected actually that this time the supply would increase. We're all set up to go. Now we have our coliseums and we have large places where vaccines can be given, and I actually think it's going to go well. I think the supply is there, as President Biden also promised at his press conference.
Well, and as for the vaccine rollout, too, the CDC has put out some guidance, right, of what can a vaccinated person do with an unvaccinated person. I'm curious, what are you telling patients or people around you? Because you can tell people are ready to get together, people who still want to be safe. Anything you can expand off of that? And do you think we might see the CDC expand more and give some more guidance beyond the limited of maybe one household, right, that's been vaccinated with an unvaccinated? I'm curious what you think of those guidelines.
Yes, I think the current CDC guidelines on March 8th are actually fair. They're a little cautious. The CDC is always cautious. So basically, like you said, vaccinated people can be together without restriction, no mask, no distancing, and then vaccinated people can be around unvaccinated people of low susceptibility, like grandparents who are vaccinated against grandchildren. But they limited that number, sort of made it a limited number of households. I think it's going to keep on, the guidance going to keep on loosening up as we go forth. I think CDC officials themselves are hanging out with other vaccinated people, and these vaccines are looking amazingly good. I think what's making everyone feel so much better is the real world effectiveness of this vaccine, as shown by two papers last week in this country, are amazing. 99.95% effective. This is healthcare workers in the University of Texas. So things are looking so good for these vaccines. You're going to see more and more loosening. And I think it's very fair for people to get together when they're vaccinated.
And before we run out of time, I'm just curious, we saw that big curve and the waves that we've gone through. How would you categorize where we're at right now in the pandemic 1 year in and where you see us going?
Unlike any other time, people keep on thinking of surges and then they get scared because things open up and then they're like, we're going to have more cases. This is a completely different time in history. We're putting down vaccine. We're giving people vaccine. It's protecting them. It's making them immune against further spread. So that's why I'm very convinced we won't see a fourth surge in this state. I think we're doing great. And vaccines work incredibly effectively, and we're going to get through this pandemic. There was a model this morning, and I believe it, that I think by mid-July, we're going to reach 70% people either getting vaccinated or they'd had some immunity before. That's herd immunity by this virus. So think about mid-July as a really good month.
All right. Well, Dr. Monica Gandhi, we want to thank you for your time from UCSF as we look ahead at some hopeful, much more hopeful place than we were a year ago. Thanks for your time this morning.
Thank you.
We want to turn now to weather. It has